We've played nice, stayed quiet, and tried to fit into boxes we were never built for. But guess what? That version, she's done. Now we walk different. We talk different because we are different. We're not waiting to be discovered because we're busy discovering ourselves. Raising babies and businesses, healing, breaking cycles, and making moves that move us. This is what it looks like when we stop shrinking and start showing up. Welcome to Totally Unmuted. Welcome again to another episode of Totally Unmuted. Today, I am so excited to welcome my friend, Miss Nurse Co.
Hello. I'm like, it's my part now.
Yeah.
Thank you for having me. I'm so excited to be here.
Yes.
If you are in an appointment and you feel that you're not seen, you're not being heard, you're not being seen, it's important for any intervention that's going on to ask, why is it that I need to have this done? What would happen if I just waited and I didn't have it done at all? And what will happen if something goes wrong? And what is the next intervention? Because what we consider, we call it an intervention cycle. You do one thing, it makes you have to do another thing, it makes you have to do another thing. And so that will make you feel a lot more equipped with knowledge to be able to make informed decisions for your care.
That is good. As we talked about Black maternal health the last time you were on, I think that was like a year ago.
Yeah.
And we kind of dived into Black maternal health, and then we also had some other guests kind of talk about it as well. And then I was like, you know what? Let's have Co back on to really do a deeper dive, just to kind of really give us more on the advocacy side of things, and then how my mommy, my baby give services out to the community and things like that. And just as we're navigating this space of people losing benefits and everything like that, what services do they have out there, and just things of that nature.
Okay.
So yeah,
Let's do it.
Let's do it. So you've been a nurse for 16 years.
17 years.
17
Yes.
years.
Mm-hmm.
And then you transitioned to labor and delivery.
Yes.
And so with the transition, why did you transition to labor and delivery?
Well, as a nurse, you get out of school and then you just go into whatever area you decide to. And I was always drawn to babies, to labor and delivery from like a young age, because it just fascinated me. The fact that, this life form literally forms in your belly and then it's pushed out. And so I began studying stuff like that, like probably in my teen years. And so it was like inevitable. When I was in nursing school, I said, I'm doing labor and delivery. And that's it. So once I got out, I did an internship before I even finished. And then I did that for about 8 to 9 years in my first, my first 10 years of nursing. Okay. I taught childbirth classes. And so I just really immersed myself in L&D.
Wow.
Yeah.
And do you think that's where your advocacy began with Black maternal health and things of that nature for moms, is transitioning to labor and delivery and just watching some of the things transpire?
Absolutely. I thought about over those 9 years, I probably have participated in, delivered, or seen 1,000 deliveries, easy. And so it made me see how women of different races were treated differently. Sometimes the same diagnosis, this person's on bed rest, this person is not. And it's so many different reasons. It's not just in the hospital, but it also extends beyond that to just when they're going for their appointments and checkups and things like that. And actually, believe it or not, most maternal deaths happen after delivery.
Yeah.
So, yes.
Yeah, I researched that.
So, in those first 6 weeks, and then beyond that up to a year. And so the really important thing that we need to be looking into is helping these moms after the delivery, having resources and services there.
Now, I don't want to glaze over the fact that you have other certifications,
right?
That are strictly, geared to moms. You are a lactation counselor as well.
Yeah.
And then give us some of the other ones. I didn't know.
I'm a certified life coach. Yeah. And so I really like looking at motherhood just as womanhood as a whole, because we were women before we were ever moms.
Yeah.
And so it's important that we are building up the woman herself. And so then when she does transition to the role of mother, be it it's one child, two children, 15 children, you maintain that sense of who you are, and you're able to advocate for yourself, because you then have to advocate for your children's needs.
Yeah, that's true.
What do you
Go ahead.
What do you think was the defining moment, like when you were working in labor and delivery? It was like, this is something that I want to. It was already something that you was passionate about, but seeing the need to start your own like business to help other women outside of what you do, because you can only do so much when you work for another person, but when you work for yourself, you can do a little bit more. So what was that defining moment? Like, I don't like this treatment. I don't like the way that the proper protocol wasn't handled, because I've had a situation personally happen with someone that I love, and I didn't like the way that it was handled. And it just, more education needs to happen in the labor and delivery.
Yeah, it's true. I think overall, it was just the fact that we would, moms would come in, families would come in, we would deliver them. They would leave and we never heard from them again. And so we wouldn't know how their life was set up to be able to help raise this child, what resources they didn't have or did have, the reason why they maybe didn't get prenatal care or had limited prenatal care. It's so many different things in your life that impacts maternal health. And I wasn't able to tap into that. And so, me, I love being able to help, wherever I can. And I thought that I would be able to work for another agency for a while, which I did. I did that for 8 years. I did community health nursing. And so I was able to go into those homes and stay with those moms for 2.5 years. But beyond that, I love God. And so I felt restricted in that sense because most of the time, if it's agencies that are government, contracted and things like that, you have to kind of like teeter-totter what you say and how you say things. And I wanted to be able to have an agency that was Christ forward and that was okay. And yeah. And so I started my baby in 2021. Yeah, 2021. And it just kind of took off from there.
So your baby is 4 years old, right?
Yeah.
4. So you still have like the maternal thing going on with your own?
Oh no, I thought you meant my baby, business. No,
I am.
Oh, okay, yes, so definitely.
You still
it's still a baby.
It's still a baby.
Yes. My actual, living babies are 8, 13, and 19. And yeah.
So when you, so you said community health nursing, how does that differentiate from, in the hospital nursing or just things like that? Can you give us a brief about?
Yeah, absolutely. So it was a home visitation program. There's programs out there that can send nurses or health advocates to your home. Mm-hmm. And usually they're government, paid for. And so they're free to the actual family. But, they provide really great, excellent care. And so I was able to go into those homes from pregnancy until that baby turned 2. Wow. And so I saw a lot, and I would see them monthly, every 2 weeks, kind of depends on their schedule. Mm-hmm. And after I finished with that, I transitioned to supervising for that agency. And so I wasn't going in the homes anymore. But I think being at the level of being able to help the nurses help their clients was a different, transition, because I enjoyed being able to impact not just my caseload, but caseload of 10, 15 different nurses.
And what did that look like? So what was that impact, going from being the nurse that was actually in the home, following these families until these babies became 2 years old, to like supervising the nurses. So what did that impact look like?
It looked like I had to really tap into more of the counseling end of who I was. Probably in a different capacity, because when you have people that are, and not saying that our moms didn't have, mental space and all that kind of stuff that they needed, but it was just a different level of being able to talk with them, because oftentimes our own lives will impact the way we're servicing other people.
That's true. Yeah.
And so helping them to tap into understanding that, hey, you maybe didn't catch this in the home because this is going on.
Right.
It was a delicate situation. And so trust had to be developed, because we had what was called reflective practice. And so that meant that they would come into my office once a week and talk about what's going on with themselves, what's going on with their caseloads. And so we can help navigate issues and problems together. Mm-hmm. And that was different,
So how many patients would one nurse see?
They would typically have like 30 moms in their caseload, which seems like a lot, right?
It does. I'm like, how often did they see?
Sometimes weekly, every 2 weeks, monthly. And so, navigating helping them to, because a lot of people think about if you were actually doing case management for that many people, that many lives, and it's not just the mom that you're dealing with. You're dealing with the baby, and you're dealing with the father, you're dealing with the extended family, because then you're in the home, the grandparents, you're seeing the family dynamics that are a little not that healthy. So it was a lot.
Yeah. So when you think about just knowing all of that, being that you've been in the industry for so long, and I when I look at motherhood and I look at pregnancy and I look at Black maternal health, just a lot of the research that I've done, I hear that, I see and I hear that it's a silent killer. But I want to know, how would you define maternal health, Black maternal health specifically, being that you were so close to it?
Oh, that's good. That's a good question. I would say that Black maternal health matters in a sense of we cannot be silenced anymore because we understand that we have rights and we understand that we're supposed to be treated in certain ways. And we see the difference. The stats are out there. Black women are dying at 4 times the rate of our white counterparts. And the reason for that oftentimes is bias, whether that's conscious bias or unconscious bias from the providers and things like that. Because if you have a mom that's telling you symptoms that she's having and you saying she's okay, then that's an issue, And so oftentimes, especially if you're a young mom, you feel like you don't want to bother anybody. You may be uneducated on what these symptoms really mean to be able to advocate for yourself. And so that's why I love part of what we do is advocacy. If a mom goes into her appointments and she needs assistance, like I will go with her. I will send somebody to the appointment with her. Yes.
Okay. So that's a service that my mom and my baby provide.
Yes. Nurse advocacy.
Really?
Absolutely.
Wow.
I was going to
They can call. Go ahead.
No, go ahead.
No, that was it. I was just going to say they can call while they're at the appointment. They don't want us to actually come physically there with them. They can call and we can listen in. We have a chat after the appointment, about questions and things like that.
Because I was going to ask, what do you think that's missing from the patient, the mommy standpoint that they don't have? And I see that you kind of answered what I was going to ask, because you have someone go into the doctor's appointment with the mom. So I feel like that's, important. So what nurse being there with the patient, the mom, is it something that the mom is the nurse asking the questions? Is she just there? Like, what's the process? What does that look like when she's going in there with her?
Okay, so it looks like, beforehand, the nurse will talk to that mom and say, hey, what are your concerns? What's not being met? What are your thoughts on your appointments? Do you feel like they're long enough? What's lacking? And so before that happens, then we go in. And the whole point is not to take her voice away. It's to empower her to be able to speak. And so you always want to give them time to be able to ask their questions. And then if you need to kind of add in a little something extra, you will. Because when they see you do it, then they're able to do it.
Okay, so it's like a before and after. Like we do a little discussion before the appointment, during the appointment, and then after. Yeah, so it makes them more comfortable. Yeah.
Piggybacking off of what T was saying about you guys advocating in terms of medical terminology, because sometimes if you don't know the terminology and then you go in and they're trying to advocate for themselves, they can feel embarrassed and things like that. So what kind of education do you guys give around that?
Yes, so we actually do prenatal classes, newborn care classes, and lactation classes.
Okay.
And that's private, or we can do groups. You have a group of moms, and that's in your home. So that way, the verbiage I use, I will give them the language terms, but I also use terms that they may hear in the hospital setting or in the doctor's office setting. So that way, they'll know what those terms mean. And they'll feel more empowered, more able to advocate for those needs that they have.
Right. That's good. How do you feel, with you actually doing that? Like, what are some of the gaps that you've seen while you guys have went into some of these rooms when it comes to the ladies?
Yeah.
Girls, but even the young girls, because I'm sure you probably work with teens as well. Well, I know you have worked with teens.
I was gonna say, I'm sure it's not an age limit.
So right. So what does that actually look like, and what are some of the gaps? I say, what does it look like? More importantly, what are the gaps that you saw when it comes to that?
Yeah, I mean, a lot of people like will use the term like I had a dry birth, things like that.
Really? Okay.
And dry birth is not actually a thing. So people think, people think that if your water breaks and your water breaks before you actually deliver, which most of the time your water will break before delivery, but usually this happens while you're in labor. So they think that if all of their water comes out, the amniotic fluid that houses the baby, that then the baby's delivery will be harder because they don't have fluid to be able to push the baby out with.
Lubricate.
With the truth is that water is continually being produced because the baby's urine, essentially.
Really?
It's like a closed system.
Okay.
Yeah. And so, you still will have lubrication for you to deliver your baby. It's no such thing as a dry birth. Yeah, that doesn't happen.
Okay, so
I'm like, that's just one of the things,
I'm like, you sure? I know this is what you do. I'm like, you sure? Because I'm like,
that's just
So being that you are in the labor and delivery room, gosh, I just know, like you say, you saw over 1,000 births. But what is one practice that you consistently see doctors do that puts Black women at risk?
And sometimes I don't know if it's just Black women, because I want to be clear that not all providers are like this. They have some amazing providers out there, Black, white, but let's just be honest, our Black women we're comfortable with people that look like us, especially when we're in the most vulnerable space we'll ever be in our lives, delivering a baby. Think about it. If you having a vaginal delivery, your legs are in stirrups. You don't have that's probably the most open you'll ever be in your life.
Look, getting the wax and getting laser, man.
Yes. And so for many women, though, that's like the first time they've ever been like that, exposed like that. And
it is kind of uncomfortable even thinking about it.
Yeah.
Do you think it's something that only younger girls or women, like what's the age group that most feel most uncomfortable with, like advocating for themselves? Is this like a teen young woman problem? Do you find that maybe older women are the same? Because sometimes, people may misconstrue that they think, oh, only your young girls may not be comfortable with speaking up. So is that a thing?
See, that's the thing with like labor and delivery. Especially if you've never done it before. It spans across all socioeconomical statuses, like age ranges. It does not matter, because if you're 40, 45 or 15, I almost see like the older moms, you feel like you should know these things. And so they will ask less questions, or kind of feel a little bit less, feel like they need support or help in that area because they should know it. And so I would say that it does not matter the age. It matters your background.
Okay.
And how comfortable you are with speaking up for yourself.
But I really did want to go back to the question, though, about what is one practice that you see, not necessarily for Black women, though, but just in general, like you were saying, that puts women at risk.
Not listening to the actual woman and what her concerns are.
Really?
Feeling like a lot of times it's pride. You feel like I'm the doctor, I'm the nurse, I'm the whatever, so I know, and she doesn't know. But women, they know when their bodies are off. And so even if it takes you educating a little bit on what their concern is, it's important to listen to it, because if you ignore a person enough, they're going to get silent, right?
Yeah.
They're just going to stop talking.
Yeah.
And imagine if you were a person that you've been ignored your whole life.
Yeah.
And it even before delivery.
Yeah.
Then for sure, when you get into that space with that power dynamic being so different, you're not going to say anything.
Right. And do you feel like when it comes to, just the statistics, because I literally could not believe that Black women die at such a higher rate than our counterparts. And when I was looking at it, me and you talked about this.
Yeah.
It's 18.6%, which that's 18 per 100,000. But for Black women, it's 50.
Yes.
And I'm like, that is wild. And so that's why I was asking you about the risk, but it goes back to just being a Black woman. Most of the time, majority of the time, 99% of the time, we're seen, we're not heard. So when we have a lot of those kind of issues and we're saying, hey, this is how I'm feeling. Just saw this recently. A woman had to give a birth to her baby in a car.
Yeah, I saw that.
The emergency room, and they would not care for her. And I just thought that was so crazy, because I'm like, we're telling you, this woman was telling you she's in labor, but you did not believe her. So it just goes back to how important it is for the doctors to actually listen. And I think as well, healthcare as a whole, like what kind of coverage they have. I think that when you have a different type of coverage, you're going to get a different type of care. Would you say that would you agree with that?
I would actually agree with that when it comes to going what doctors you can see. Because,
Okay.
you know, you're referring to Medicaid versus private insurance. There are certain doctors that will not take Medicaid due to the low amount that it pays out.
Exactly.
Per visit, things like that. And oftentimes doctors or physicians that do take Medicaid have to stack those patients up so you know, so much to be able to get the same money that somebody that's only taking private insurance. And so that's why it's such a difficult thing, because it goes all the way back to insurance, you know, what insurance will pay for. Now, I would tell you in the hospital setting, it's pretty much the same across the board. We really don't even look at the insurance. But it does matter for physicians. Yeah, it does. And there was another piece to your question I wanted to address. Remind me, it was something else you said about.
I don't know.
The insurance.
Back to about the healthcare, but I was gonna say in terms of that, you know, sometimes we're not looking at the early signs. You know, we're trying to advocate for ourselves. We're not being heard. But outside of that, you know, again, it is a silent killer. It really is. And it typically happens after birth.
Yes.
So what are some of those signs or red flags that sometimes we're just not looking at or we're not seeing or we're not feeling? Just like with cervical cancer. You know what I'm saying?
Yeah.
Like, cervical cancer is a silent killer, you know?
And I was going to ask to piggyback, because it kind of is the same thing. How important is it for women to, would you say, like we know our bodies, to pay attention to our own body, like teaching women, like if something feels off, because I know sometimes this is your first pregnancy, everything feels weird. This feels weird. That feels weird. Like, am I supposed to be feeling this way? And then, you know, you go to a doctor and the doctor's dismissive, like, but it still feels, you still don't feel right. You should probably go with your gut. How important is that, along with, like you said, like cervical cancer and all of those things that women deal with, that they are maybe not the early signs of getting the detection, like paying attention, close attention to your body. How important is that, along with me?
Right.
Because it kind of is the same.
Yes, very important. And if you would think about signs for postpartum, a lot of times you have the baby, it's like, okay, I'm done. But also you need to think about that you can still get blood clots. So if you're having pain in your legs and it just won't go away, if you feel like you're having shortness of breath, if you're having headaches that won't go away, blurry vision, back pain that's just so persistent that it won't go away, all of that could be signs of different things that we take serious. And yes, very important for you to take account that if something is off in your body and you feel like something is wrong, it is okay for you to go. I don't care if you go and they say it's nothing 15 times. Keep going.
But so, okay, and that's, I think sometimes that's easier said than done.
I know.
It is.
It is.
Done. But I think like having more education around certain things, like, okay, you may go to the doctor and you may say that it's this, and if you say it's this and these are the symptoms, because we'll go to Google and Google.
You took the
last breath.
You took the words right out of my mouth. Google will have you with cancer.
Yeah. Like,
any symptom is cancer.
Yeah. So I'm just saying, like, having certain things, like, you know how sometimes you can weed out what something is. I don't think there's enough education behind after birth complications that people need to weed out. And I'm saying that because my daughter's cousin, after the birth of her last child, she literally had 3 heart attacks. And this girl was not even 25. Seriously.
Yeah, I believe you.
Like,
and I'll tell you why that happens sometimes. But go ahead.
It was something. It was so scary for me because I was, I was so close to her, and I kind of like watch her grow up. Watch her grow up. That when she called me from the hospital, I could not fathom this. This girl was not even 25 years old. And on the way to the hospital, her mom told me, on the way to the hospital, she had, I think you have 3 ventricles that go to your heart. Okay. 2 of them had torn. On the way to the hospital, they lived in another part of they lived, in another part of Louisiana. On the way to the hospital, they told the mom that if that third one broke, she was no longer going to be here.
And see, that's the hard part. So what happens is a lot of times people don't recognize that the physiological changes that happen while you're pregnant.
Yeah.
So your blood volume actually doubles when you're pregnant. So think about a heart that may be stressed already and you don't know it. And now you're putting all this extra blood volume needing to be pumped throughout your body. And so it's putting more pressure on the heart. So oftentimes we'll see that even if you didn't know you had heart trouble, you figure it out afterwards, or you figure it out during the pregnancy.
And I don't think she knew, but the daughter, if I'm not mistaken, her first daughter had a lot of complications with her heart, but I don't think she ever knew. And the funny thing about it is, when I asked her, I was like,
"So did the mom?"
No, the daughter, the daughter's daughter.
Okay.
Because this was her second daughter. She had a lot of complications as a baby, right? And she had, I don't want to say this for sure, but I think she had something that was wrong with her heart, if I'm not mistaken.
Okay, when she was a baby.
No, the daughter's baby.
Okay.
You get what I'm saying? The baby. Then she had another baby. When she had the second baby, that's when she had the heart attack.
Okay.
And what she was telling me was, when I was explaining to her, when I was asking her what happened, like, what did you feel? You know, because the baby was literally probably like a few days old, seriously. She said she had made the other baby some oatmeal, and she went to bend down to do something. And she said when she went to bend down to do whatever it was that she bent down to do, that's when she went out. And then, her mom ran out and all this, but she had 2 heart attacks.
So someone was at home with her.
Thank God.
So thank God for that.
And I was going to say,
we typically have atypical symptoms when it comes to heart attacks as women, just in general.
Yeah.
Like
what's atypical? Because everyone doesn't know what that means.
Yeah, so not the typical symptoms of like the arm numbness and pain and things like that. So we may have like just a little neck pain. Oh, I feel like I have a little crick in my neck, or I felt a little dizzy when I got up just now. But we just write it off.
Yeah, but how important is it that she wasn't at home by herself? Because maybe the mom would have just stepped out and I'm going run to the store right quick, because a situation similar happened with my sister. My nephew was maybe 2 days old, and she had fluid in her lungs, but she didn't know.
Wow.
And my mom was like, "No, you need to go to the hospital." She was like, "My chest feels really heavy. Feel like something, like an elephant or something is sitting on my chest." And she was like, "No, you got to get up." And thank God that she did. But the whole process of my sister's situation is why what you do is so important, because from delivery on to after baby, the meconium,
because my baby had meconium as well,
her needing a spinal tap because they did the epidural wrong. How often does that happen? Because they had to
very often.
They had
so they must have had to do a blood patch to be able to control the headache that can come.
They did, but they didn't listen. For 24 hours, she could not raise her head. She was like, "It is excruciating for me to raise my head. It hurts really bad, like my neck hurt." All of the things. I got on Google. Now, that was one time Google was right.
Yeah.
I put all the symptoms in, and I found a medical book, and it said that she was going to have to do a blood patch. But they waited 24 hours before they even
and which could have, again, and killed her, And so I just think that even with thinking about that, it's just astounding. But I think one of the things that I was kind of researching was having a birth plan. I've never heard.
Yes, so we do birth plans as well. We do birth plans and we do postpartum plans because both of them are important.
Yes, and walk us through what a birth plan actually looks like, a birth plan and a postpartum plan, and how moms can start, implementing this as they are, going into pregnancy, thinking about, once they're about to have the baby and things like that. Yeah, we be having a car seat and a diaper bag ready.
The baby shower. We got no plan. We got the baby shower plan. All the things. We got the photo shoot ready.
Yes. Because again, having someone there, knowing that these are some of the symptoms that could happen, so I need to have someone there with me, maybe around the clock, or tapping into having a community health nurse. So what does a birth plan look like, as well as a postpartum plan?
Yes. So birth plan is a typed out document that you can find. There's a wonderful website, mybirthplan.org. Now, the problem with that is that a lot of things on there, you may not understand what it is. So if it says are you okay with your water with being ruptured?
Mhm.
You're gonna say, what is ruptured? And why wouldn't I want that? And so it's good to have somebody that knows the lingo to be able to help walk you through it and help you fill it out, which is what we do. But it's gonna ask you, do you want your lights dim? Are you okay with all the medications that your child is gonna get afterwards? So that way, when you go to the hospital, you don't have to answer all those questions. It's already there.
Mhm.
You go and you actually have your doctor sign it while you're still pregnant. So that way you'll know that it's approved. A lot of times if women don't want to get an epidural, and so we may not want to do IV hydration, which is the IV in your arm, you cannot have that. You can opt against that. You can have intermittent fetal monitoring, meaning you're not plugged up to this machine the whole time,
Right.
So a lot of that stuff can be alleviated beforehand. And oftentimes for my moms that are going natural, we'll have a code word for the epidural. So,
Really?
yeah. So that way it kind of, you work in mental health. So
Yeah.
it makes your mind have to think a little bit harder to think about what this code word is.
Right.
Because if you say, if it hurts too bad, I'm gonna get my epidural,
Right.
then it's gonna hurt too bad and you're gonna get your epidural.
Yeah. So you would say the birth plan is just pretty much a pre-typed out plan that says, even if I need to know if you're about to give me a medication, I need you to explain what this medication is.
Yes.
Even in terms of who's gonna be called if this happens and who's gonna be in the room.
Yes.
Same thing with the postpartum plan. Now,
yeah, it's a roadmap.
okay, it's a roadmap. So
yes.
a pre and post birth plan, a pre and post pregnancy roadmap.
Yes.
And how would a doula fit into this? Because I've been seeing so much stuff.
Yes.
And girl, I even saw how they have Medicaid pays for doulas.
Oh,
yeah.
Is it because it's along with that? Because is it a shortage of like doctors? Because I noticed that, like with Ashna in particular, they use mostly doulas. The doctor usually don't come in, so.
So let me clarify a couple things. So there are areas that what we consider like maternal health deserts, that they have to travel more than like 30 minutes, an hour to even be able to deliver or have a hospital that delivers them, which is a difficult thing because if you're in labor, if you think there's a problem, you have to travel all this way to get care. Now, what you're referring to is you probably are seeing the registered nurses, the labor nurses, come into the rooms more than the doctor, because the doctor typically only comes when it's time to deliver. But the nurses, we have standing orders to be able to follow for deliveries. And then also, if there's an issue, we call the doctor.
So you a mini doctor, basically.
But the nurses are delivering the babies.
I would say oftentimes we end up delivering the babies because, let's just be honest, babies sometimes don't wait on somebody else to come, when they're coming.
Wow.
But the plan is that we try and get them to push to the point of we can hold off. We can call the doctor. Doctor
can make it.
Yes, can make it for deliveries.
So
but that's why we have to be trained in delivering because babies don't wait. They ready to come out. Okay.
Thank you for that information.
So but the doula situation, doulas are basically lay people that's decided that they want to be able to help with births, or even they have postpartum doulas too, or after, and so they're provided with the education and the skills to be able to provide comfort measures and things like that. But they're not typically are clinical people that know, how to read a labor strip and know how to do an IV and things like that.
Okay.
So insurance companies are paying for doulas because that's an extra person that you can have at your bedside, and doulas are great and wonderful.
Yeah. And I know you just recently started working with one with my mom and my baby.
Yes, I brought a doula on because I take on a few labors, myself personally. Only like 2 or 3 a year.
Yeah, you did this year, didn't you?
Yes, I did 2 last year.
Yeah.
This year, and but it's time consuming, and I love it. But I know that I would need somebody else to be able to really fulfill that that need that I'm getting from a lot of people, and and it was one that I trusted. It's one that loves the Lord because a lot of sometimes they may be into some other things that I'm not. I would not want my patients or my clients to be involved in, and so it's important to vet people that you work with.
That's good. I think this was really, really good. And I really appreciate you coming. But I do, before we, wrap and move on, I do want to ask you one question just for, Black moms in general. But again, I wanted to specifically talk about Black maternal health. What is one thing that you would tell women if they're in an appointment, they don't feel heard? What is one thing or one piece of advice, I should say, that you would give them to really advocate for themselves when they're in these appointments and they just don't feel seen, they don't feel heard?
Okay. You want me to say it to the camera?
Yes, you can say it to the camera.
Okay.
And now it's time to shoot your shot. Okay, so we're shooting your shot, right? This is if you wanted a brand deal, if you wanted someone you wanted to work with, just anything, it is your time to look at the camera and you got to shoot your shot. Not shoot now. I'm going to tell you because I tell people this all the time. This ain't like when people used to be shooting their shot. It's like, hey, Black.
I'm about to say, because I hadn't done it in a long time, but I can pull it out,
We don't want Bo coming up here, so we ain't pulling nothing out. Okay?
I can pull it out the back if I need to.
Girl, you're going to have to go way back, girl.
I
Okay?
know.
So it's just your time to shoot your shot. Give us your little 15-minute elevator pitch.
15 seconds.
Oh, wait, yeah.
'Cause that's a long elevator pitch. But I can do a 15-minute one.
Nah, we're going to stick to the 15 seconds.
All right. To the camera, to you.
To the camera.
All right.
Shooting your shot at me, baby. I don't want you.
Okay.
No, I'm playing.
All right. So, hospital systems that organize and work with several hospitals that do deliveries and things like that, I would love to work with you to be able to formulate plans and come on as consultant to be able to work with these moms to help to advance your systems and grow your trust with these moms, because we have to make a change.
Yes.
And Black Moms Matter.
They do. And what's one service that you would provide to them that they're not going to get anywhere else?
Oh, nurse advocacy, actual labor and delivery nurses at the actual bedside that are not necessarily part of the hospital setting, but they're just there to be able to advocate for that mom's needs. And education. Yeah.
Y'all heard it here. Thank you guys for tuning in to another episode of Totally Unmuted. Keep laughing, keep loving, and keep leaping.
Yay!